Welcome everyone to this very important session on diabetes remission with nutrition and lifestyle. And I am Dr. Pratyush Kumar, and today we will discuss some of the important basics regarding diabetes and how we can send the patient to remission with nutrition and lifestyle. This is one of the common questions which patients ask us, that for how long we need to take medicines, how long we need to take insulins, can is there any cure of diabetes? For a part of subgroup of diabetic patients with lifestyle and nutrition, they can definitely go into a remission. There is a specific criteria when we can say that yes, our patient is in remission, and how to assure that the patient remains in remission for a longer period of time. All the aspects related to it we will discuss in these topic today, and briefly we'll discuss in various aspects. We'll take some of the common complications, issues regarding medical nutrition therapies, uh, some of the good things, changes which everyone needs to know regarding diabetes. Okay, so need for nutrition and lifestyle intervention in diabetes mellitus is what's needed nowadays. And we know that obesity is a potent independent risk factors for development and progression of type 2 diabetes. A sustained weight loss of 5 to 10% is associated with better control in diabetes. It reduces the risk of diabetes, even in those patients who are already diabetic, and those patients who are pre-diabetes, they can go back to their normal conditions. This is the definition by Association of British Clinical Diabetologists and the Primary Care Diabetes Society. They have defined that when we can say that the patient is in diabetic remission, if the fasting is less than 126 and HbA1c is less than 6.5, then patient is considered to be in the diabetic remission. Types of diabetes remission. There are three different types which we'll discuss. One is the partial remission, where there is subdiabetic hyperglycemia, not diagnostic of diabetes, where HbA1c is less than 6.5%, fasting glucose is less than 126, at least for 1 year, in the absence of active pharmacological therapy or ongoing procedures. Patient is considered to be in complete remission when the blood glucose is within normal limits, HbA1c is less than 5.77%, fasting blood sugar is less than 100 for almost 1 year, and patient hasn't taken any kind of medicines or hasn't gone into any kind of procedures. Prolonged remission, when this patient who has achieved complete remissions continues it for more than 5 years, then we call it as prolonged remission. So if you look at the general nutrition guidelines for the patient with diabetes, the recommendations are as that we need to attain the desirable weight should be less than 25 kg per meter square, and we need to regulate carbohydrate intake to 55 to 65% of energy. We need to choose whole grains, legumes and vegetables, use fruit and other sources of mono and disaccharides in moderation. Regulate other intakes as following, like fiber you need to take 25 to 50 gram per day, protein should be 12 to 16%, and total fat should be less than 30%. But in the fat you should understand that saturated fat should be less than 10% of the total energy, and the monounsaturated fatty acids should be 12 to 15%, polyunsaturated fats should be less than 10%, and cholesterol should be less than 200 milligram per day. So overall, what it says that your diet should have the perfect balance of protein, lipids, carbohydrates, and you should take lots of green leafy vegetables, legumes, whole fruit, because the fiber will delay the blood glucose absorptions. So that with every meal you need to take lot of salads. It contains lots of fibers. What fiber will help you that once it goes into the stomach, passes through duodenum where there is glucose absorption, it will delay the absorption of glucose. So even if you're taking a glucose rich meal and the glycemic load is high, If fiber goes along with it, there will be delay in the absorption. So what it will do that the glycemic variability, when the blood sugar goes high and low, that will be within a specific range. That there won't be much fluctuation in the blood glucose levels, and that's what is needed. We need to also minimize the glycemic variability, because that only leads to various kind of complications like neuropathy, retinopathy, and nephropathies. So the recommendations on energy balance and weight management is to support weight loss and improved A1C and quality of life in adults with pre-diabetes or diabetes. Medical nutrition therapy should include individualized eating plan in combination with enhanced physical activity, and that's very important because every patient has got different kind of taste, different kind of food preferences, different kind of lifestyle. So while planning their diet, you should consider their preferences. Then only there we can achieve a good compliance over the diet. For adults with type 2 diabetes who are not taking insulin, a simple and effective approach to glycemia and weight management is to emphasize on the portion sizes. Healthy eating may be considered. In type 2 diabetes, 5% weight loss is recommended to achieve clinical benefit. Goal for optimal outcomes is 15% or more when needed. Usually what we see that if your blood glucose is not within control and remains for a longer period of time, then we suddenly start seeing weight loss, because that is because of catabolism. We see, and also with passes of protein and sugar with your urine, we see lots of muscle breakdown, and that leads to your weight loss, but that's not what is desirable. What is needed that you do weight loss based on a diet control, and even when you're doing a diet control, you should make sure that still there is a good proportion of carbohydrate, protein, fats, essential nutrients, so that you don't develop any uh, deficiencies and any kind of diabetic related microvascular complications. In pre-diabetes, those who are between 5.7 to 6.4% of HbA1c, the goal is 7 to 10% for prevention of progression to type 2 diabetes. Many patients come to our OPDs with HbA1c of 6%, and they are the patients how we can prevent them from developing diabetes. We can counsel them that they can take proper diet control, they can, without medication, they can prevent diabetes from happening in the next few years. And people with pre-diabetes at a healthy weight should consider both aerobic and resistance exercises and a healthy diet plan. Nutritionists should implement 3 to 6 medical nutrition therapy encounters during the first 6 months following diagnosis of diabetes, and determine if they need some extra assessments. The dietitian should implement a minimum of one annual follow-up encounter. Therefore, the National Academy of Medicine recommend individualized medical nutritional therapy as part of multidisciplinary approach to diabetes care. So, remission of pre-diabetes and role of high protein and high carbohydrate diet. So, after 6 months of treatment with high protein diet, there was 100% remission of pre-diabetes, whereas in case of high carbohydrate diet remission, this was seen in only in 33% of population. Both diet groups had significant weight loss at 6 months from baseline. High protein 9.8%, high carbohydrate 11.3%. Subject in the high protein diet showed greater increase in GLP-1 and GIP, which stands for glucose dependent insulinotropic peptide, along with improvement in insulin sensitivity and beta cell function, and decrease in insulin and glucose area under curve than the high calorie diet subjects after 6 months of diet. So high protein diet caused reduction in ghrelin levels compared to high carbohydrate diets, which indicates that high protein diet may have greater effect on satiety. The rule of three: ways to achieve a diabetes free life. First is fructose avoidance. And if we look at the common sources of top dietary sources of fructose, the most important determinant of fatty liver is not just carbohydrate but the fructose content in the sucrose and corn syrups. Hence, some of the food that needs to eliminate it from daily dietary habits include sweetened beverages, sodas, iced tea, sports drinks, mixed alcoholic drinks, processed juices, smoothies, coffees. These contains lots of fructose. Apart from that, if you look at cookies, cakes, desserts, so everything which is very sweet and you take it, it's a high time we should avoid those fructose containing diets in that. Reducing eating intake of refined carbohydrates. In general, you should avoid any kind of processed food because that the key here is to reduce or remove refined wheat products, limit use of processed corn products and white rice. Some people also recommend to use brown rice instead of white rice, but it also has contains some kind of uh, fiber also is there in the brown rice. A diet which a physician can recommend to their patients in such a case can include low carbohydrate and high fat diet. The idea here is to promote the use of real foods, reserve the use of industrial processed food to those who need them due to their altered physiology. Next slide, please. Okay, so intermittent fasting. This is one of the very much talked after topic that how intermittent fasting can help uh, people overcome diabetes. So the reversal of type 2 diabetes depend on two factors. One is you need to stop the intake of glucose and you should also need to burn off the remaining sugar. So you need to have fine balance, the intake and the output. The intake of blood glucose, whatever the sugar you consume, and the output, how you burn it. And if you'll achieve some kind of a negative balance, then obviously you can manage diabetes. A low carbohydrate, healthy fat diet reduces the incoming glucose load but does not burn off the existing sugar content of the body. So that's the problem with LCHF. It may reduce the sugar intake but may not help you to burn the excess sugar which is there inside it. Next slide, please. So, follow up recommendation in patients who have achieved diabetes remission. So, those who have achieved diabetes remission, they need to continue it for a longer period of time and they need our continuous support to maximize the long term avoidance of weight regain. Next slide. So, the big question is, can diabetes remission be achieved in clinical practice? The last trial demonstrated that a low calorie liquid diet could successfully be implemented in primary care. However, patients in the trial encountered weight regain. A solution to the weight regain is to use anti-obesity medication. However, the issue of metformin also needs to be discussed here. Metformin is one of the very common drug which we prescribe in our diabetic patients, even in pre-diabetes and even GDM, gestational diabetes mellitus, we prescribe metformin. And one of the beauty of metformin is that it also helps in weight loss. But if we are giving metformin for a longer period of time, then we should also be careful regarding supplementing vitamin B12 because it also causes vitamin B12 deficiencies. The question that arises whether we should consider diabetes to be in remission for patients who are taking metformin for weight loss maintenance. So this is the cost question which you need to discuss with your patients, that whether they are comfortable taking metformin or not for the weight loss. Next slide, please. The first step for ensuring diabetes remission is its diagnosis based on clinical findings. Lifestyle and nutritional interventions are among the key players for achieving diabetes free quality of life. Moreover, protein, fibers, and low glycemic index are key pillars when trying to achieve diabetes remission through nutrition. Intermittent fasting, along with fructose avoidance and reducing intake of refined carbohydrates, forms the key to the control of diabetes and even its reversal. Although diabetes remission is subjected to controversies, it's best to follow up such patients at regular intervals to avoid fatal outcomes. The basic key message here is that diabetes reversal and diabetes remissions is possible, but it's not possible in all the patients at all the time. We need to select the right group of patients who can achieve diabetes remission based on their clinical findings, based on their lab parameters, and in basics, low carbohydrate and good amount of protein with intermittent fastings can help to achieve some kind of diabetes remissions. Patients needs to go apart from nutrition. What's more important is their lifestyle, whether they are doing aerobic resistance exercises or not, because that also helps to maintain the weight, to prevent any weight regain. 5 to 10% weight loss would be optimum for all our diabetic patients. If they do some such weight loss, their diabetes control will be good, and they can also go into a diabetes remission. Thank you, everyone.